For a long time, this disease was associated with witchcraft, a serious mistake since the elderly who behave strangely and lose their memory are frequently suffering from a neurological disease. A recent study shows that Alzheimer's disease and vascular dementia are progressing in Africa at the same rate as the aging of the population. In Zambia, an organization has taken up awareness-raising campaigns and hopes to draw the attention of the authorities to this condition and avoid the stigmatization of the patients. Report by Joshua Jiri, our correspondent on site.
She picks oranges for her 3 grandchildren. Salome Piri, a retired civil servant living in Lusaka, Zambia, once lost her memory while driving in one of the city's suburbs.
I was coming from Garden Compound, so I was going to Olympia Park, trying to come to Chainama. Then on the way, I didn't know where I was. So I just stopped the car at a church, then parked there waiting for my memory to come back.
Loss of memory is one clear symptom of dementia, but in a society that is not aware about this condition, losing memory in public can have dire consequences for old people in Zambia. When members of the public see an old person wandering aimlessly or idling in a place where they are not known, they are often subjected to violent and verbal abuse on suspicion of practicing witchcraft. Rachel Shankwaya's mother suffered with dementia for a long time. Neighbors would often suspect that her mother was a witch because she behaved strangely and had difficulties eating.
You know, it was very traumatic, especially for me because I looked after her for 3 years. So each day you'd see her going down and she's not eating and you're wondering what's happening to her. And because of that, some people don't come to visit you. They are scared. Even the neighbors, they stopped even asking or coming to visit because they think she's got a mad woman. Some people would say she's a mad woman. Some people would say she's a witch also. So you are traumatized and you're also stigmatized.
Rachel Shankwaya is a member of an organization called Alzheimer's Disease and Related Dementia in Zambia. The association has 11 board members and 59 members represented in 4 of the country's cities. It is made up of dementia caregivers and neurologists that are interested in raising awareness about Alzheimer's disease and dementia and giving patients the best health care they can.
You are able to come to us through this forum. We have a Facebook group and we also have a WhatsApp group which is composed of doctors, neurologists. Those are the people that are helping us. When we have a patient, we take them to these particular people who are helping us to understand this disease and also to help us to take care of our beloved ones.
At Lusaka's Chipata General Hospital, 3 out of 10 clients at the weekly neurology clinic will have dementia-related conditions. Dr. Moses Mata, a member of the Alzheimer's Disease and Related Dementia in Zambia, agrees that there is a lack of relevant data about dementia in Africa.
We don't have a lot of local data around dementia, but we do know that globally there are over 55 million people living with dementia right now, and this number is expected to more than triple by 2050, and most of these will be in countries like Zambia, low and middle income countries. So we know the numbers are there, but we're working on actually counting and seeing what are our actual numbers.
Zambia has witnessed social media postings of old people being beaten or burnt to death on suspicion of practicing witchcraft.
Yeah, it's a lot of that. It's going to be elderly people who are behaving in a particular way, and because of our culture, our setup, it's the easiest explanation I think that people can come up with to say, if I find an elderly person walking around naked in the middle of the night, they must be a witch, not realizing that this is part of what happens in dementia. So people are accused of being witches, they get lost, they wander, they don't know who they are. So people are beaten up. We've heard stories of people being threatened to be burned, all sorts of very unpleasant stories, even people in some parts where they've been killed because of these accusations. So they bring that. Sometimes people are brought by Good Samaritans who just rescue them from crowds. They're brought by the police. So these are the stories we hear quite often. Family members neglect them. accident, they abandon their relatives, and all because of witchcraft, to say, no, this is a witch, even if it's my relative, I can't take care of them, so they just abandon them.
For the future, Dr. Mata and his colleagues in the association want government to develop campaigns aimed at fighting stigma associated with dementia.
So we have to recognize that dementia is a problem in Zambia, and it's a problem that's going to affect healthcare and the cost of healthcare. People with dementia may be diagnosed at the age of 65 and live with it up to the age of 80, 90, and they're going to need access to healthcare. So recognizing that we do have dementia in Zambia and being very deliberate in having a national dementia plan as a country. As Zambia, we have committed to have a national dementia plan, but we have not yet acted on it. The dementia plan is going to clearly outline how we will take care of people living with dementia, how we will finance the health care and the social support for people living with dementia.
For Salome Piri, the experience of losing her memory while driving scared her. Fortunately, she was sensible enough to stop the car and wait for her memory to come back.
It was scary. That's why I stopped, because if I had continued, I was going to get lost.
Getting lost is what many people living with dementia experience, and the Alzheimer's disease and related dementia in Zambia wants the government and community to pay more attention to this condition so that old people with dementia are not killed on suspicion of practicing witchcraft.